My name is Dr. William Morrone. I'm the medical director of Recovery Pathways. We're here to help people who say that they lost control. Hi, who am I talking to? And you have a 58-year-old female cardiac arrest? So does it look like she had some rubor mortis and rigor mortis and she'd been down for a couple hours and it looked... Are there any drugs or paraphernalia on scene? Okay. Here's what I need you to do. We're probably going to put her in the morgue. And you get me like a name, date of birth, and the address you were at, and fax it to the office. Actually, how far are you from Pine? What I see and what I do is I assimilate the data, do some statistics, and I make graphs and charts and show the county executives and the bureaucrats that work in our system what's happening with autopsies and toxicology data. And clearly, we're in a full-blown epidemic, and maybe even larger than an epidemic, for drug use right now. There are people dying who really were just looking to let off some stress. There's people dying in car accidents from using heroin, which people never use heroin and drive. It's just, you don't do that kind of thing. And it's just as bad as smoking marijuana and drinking alcohol. You're impaired and you shouldn't drive a car. Here's the idea is that I have been a cannabis education advocate in a medical setting. When you give broad access to cannabis to adults with no medical reason, driving fatalities triples, and the number of cannabis positive autopsies goes up because of impaired driving. When you give broad access to cannabis outside of medical marijuana, you increase the likelihood of schizophrenia 4 and 5 times in young people. And the people who have schizophrenic breaks have deeper and more pathological psychotic breaks. Broad access to cannabis is partly bad because we just don't have the tools we need. When I was talking to you about helping people with alcohol, cocaine, and opiate problems, all of those have some kind of medication-assisted treatment. If you struggle with alcohol, I have medications we can use in counseling. If you struggle with heroin, I have medications we can use in counseling. The problem with cannabis and cannabis use is it's seen as very safe and harmless and innocuous, and people say, well, I'm not addicted and I can stop anytime I want, and they don't see their own impairment. They have very poor judgment, and that comes down to decision making, like driving cars. They say it's probably even safer than alcohol. Well, that's wrong. It's different than alcohol, and they both make driving fatalities go up, so why would you add something new like that? What I say to people is I support cannabis education in a medical marijuana setting, but not broad access, unfettered to cannabis in general society by any adult. And that's where things become reckless. And unless you have a reversal agent with all the new high potency cannabis, we're seeing people admitted to hospitals for cannabis toxicity. What do you do with them? And it's actually not really smart to put cannabis or THC into candies, cookies, and brownies in a home that has children. So there's a lot of things that just really haven't been thought out. The other thing is they race to make you vote, and they rush you on a decision that you just really don't have all the facts that you need. We need more time before anybody could possibly consider this as a recreational opportunity.